Hello everyone, this is Dr. Krusty, and today we're doing a live demonstration on this beautiful patient. Her name is Natalie. She is 32 years old. So we're gonna start doing our first thing, which is the most important thing. It's the face assessment. So the assessment and the plan is very important. Why? Because most of the patients, they cannot do all the plan in one day, for many reasons. First, maybe financially, they cannot do all the injections in one session. The second reason, maybe it's their first time, and usually when it's their first time, they might be a bit scared to do so many injections. So it's very important to have a plan, and then at the end of your analysis, you decide what to prioritize. So what to do first, and then what to do in the next session. So starting with this patient, this beautiful patient, we first start with the facial expressions. This is very important. So I'm going to ask you, please, to raise your eyebrows, lift your eyebrows up, frown, frown, like this, frown, and smile. So as we can see, this patient, she has expression lines, and these can be fixed or improved using Botox. So if we inject Botox in the forehead, in the glabella, and around the eyes, this is going to improve these lines, and it's going to give her a nice lift for the eyebrows. If we ask her to smile, smile again, so we can see that she has fine lines in the lower part of the cheeks, and this we can inject it with skin boosters later on. However, if we ask her, if we look at the proportions of the face, if we look at the upper face, so we can see that the upper face, the distance, and the middle face, they are symmetrical. However, if we look at the lower part of the face, we feel that she has a smaller lower face, and this actually affects the shape of her face. So if you look at the face, it looks a bit more squarish. However, if we fix the chin and we give her more space, more distance in the lower part of the face, this will definitely give her more elongation and more symmetry for the face. If we divide the face into three parts, so now we talked about this, and then we're gonna talk about the skin quality. So if we look at her skin, she has a thin skin. That is, she has a lot of pigmentation. This is because she's not putting sunscreen and she's been exposing her skin to the sun. We see a lot of solar lenticels all around the face. And we don't see a lot of hydration. So her skin is a combination of skin, and it's a bit dry on the sides. And this we can actually treat it later on with either skin boosters, or we can do a bit of Sculptra. In her case, because she has volume in her face, Sculptra is not a very good option. I would rather go for skin boosters. However, if we have another patient who has loss of volume in the face, then in this case, Sculptra would be a good option. And this way, we can be fixing the volume loss. At the same time, we can be working on the hydration of the face. Now we're going to do more facial analysis. So we always split the face into three parts: the upper face, the middle face, and the lower face. Looking at the upper face, we talked about the lines. So the expression lines over the forehead, we can fix it with Botox, with toxins. We can do Botox for the glabella, the forehead, and around the eyes. If we look at the temples, we can see that she has a bit of volume loss in this area. If you can turn your face to the side, and we see there is a mild drooping of the lateral eyebrows. So in a woman, the eyebrows, they can, if they are nicely lifted, this would give a very nice feminine look, and it will give a better look for the eyes. So always the eyebrows in women, they have to start low, go up, and never go down. So to be able to lift the lateral eyebrow, the best way is to inject in the temples. That way we can fix the volume loss in the temples. At the same time, it will give a nice lift for the lateral eyebrows. Looking at the middle face, we can see that she has not a lot of definition between the middle face and the lower face. So we can see that she has a flat plane, and there is no contouring for the cheeks. So, and she has a bit of drooping in the lower cheeks. To be able to lift the lower cheeks up and to give her more definition, we would inject the zygomatic arch. In this way, the face will look a bit slimmer, will give more elongation to the face. At the same time, it will give her a nice definition. And definition in women is very important because when we have more definition, this is also a good sign for, it will give her more of a feminine look. And this is important for a woman. If we look at the nose, from this side, we can feel she has a bit of a small depression in the upper part of the face, and we have a small, tiny little volume loss at the end of the nose. So to give her more of, like, to give her a better profile, we can definitely inject the nose, so she will have a straight nose and a better look when we're looking from the side. If we look at the lower face, from the side, we can see that she has volume loss at the end of the jawline. We do not want to inject the jawline on the medial side because this is going to give her a wider lower face, and this is not the point. We want to give her a more feminine look. However, the volume loss that happens at the lateral side of the jawline, it will give her a more droopy face around the chin area. So to give her more definition without increasing the width of the jawline, we would inject also this area with a lifting filler. And then we were going to talk about the different types of fillers we can use in different areas. Looking at the face, so if we look at the rickets line, we can see she has nicely projected lips. Her chin is a bit retracted to backwards. So to be able to elongate the lower part of the face and to give her a better proportion, at the same time to give her a better lift for the submental area. In this case, we can project the chin using also a lifting filler. So basically, in her case, we're going to be injecting the temples, we're going to be straightening the nose, we're going to be lifting the cheeks, defining the jawline, projecting the chin. Whenever we want to inject, it's very important to choose the right product. So I'm going to show you the different range of products that we can actually use. Give me the... So Restylane, we have basically 6 different products. So we have the Refine, the Kiss, the Volyme, and the Define. These are all OBTs. So these are soft gel, and they integrate nicely in the skin, and they do not affect the facial expression. So when we are moving our face, we do not feel that there is filler because it does not affect, because it integrates and it's a soft filler. And then we also have the Lift, which is Nasha technology, and this product gives more of a lifting effect to the face in different areas. So depending on the effect or the result that we want, we have to choose our fillers, which product to use and what to inject in which area. So we're going to start based on the plan that we had. So starting with the upper face, so we are planning on injecting the temples. So injecting the temples, in this case, I'm going to use Volyme, Restylane Volyme. Restylane Volyme, it's going to give her a nice lift. At the same time, it's going to fill the temporal area. How much we're going to inject? We're going to inject 0.5 cc in the temples, so we can give her a nice lifting effect and fill the temples. Now going to the middle face, in the middle face, I want to give her a lift. I do not want to give her a lot of volume, because she has a full face, and giving her volume might not give her the result that she's looking for. She wants to have a slimmer face a more lifted appearance, a more oval shape. So in this case, we're gonna use Restylane Lift. Restylane Lift, the nice thing about Restylane Lift, it will give just a bit of volume. However, it will give more a lifting effect to the cheeks, and this is exactly what we're looking for. For the jawline, I do not want to give her volume. So what I want to give her is more of a lifting capacity. So I want to lift and give her more of a straight line to the jawline. So after working on the middle face and lifting the middle face up, defining the jawline will give her this extra lift that she's looking for. Working on the nose, we have to do 2 injections, and basically we are gonna also use Restylane Lift. Restylane Lift for the nose, it's perfect because it's a precise. We want something that gives a nice precision. We do not want to give volume. We want to be precise because we're just fixing small, tiny little areas just to give her a nice, nicer, straighter chin. For the chin, for the nose, for the chin, at the same time, we want to project the chin. I do not want to give her volume. Remember, women, they have a slimmer chin, more projected chin. In males, you want to have a wider chin because it gives them more masculinity. They will look more masculine. So in this case, we have to use also Restylane Lift to project the chin and to have a more proportional face. So we're gonna clean the face. I already numbed the patient to have a more comfortable experience. And we are gonna start marking the face area by area and then injecting. So starting with the temples. So the temples, we have the anterior temporal line, and we can actually feel the bone. So once you feel the bone, you have to mark the bone, and we go 1 centimeter up and 1 centimeter down at an angle. So basically, this is our point of injection, which is here. So what are the major vessels that pass along this area? So we have the superficial temporal artery and vein. They usually go this. And then we have the frontal branch and the temporal branch. They go this way. However, when we inject, we're going to inject on the bone. At the same time, we're going to aspirate just to make sure we do not inject and cause any embolism inside of the vessel. So we're going to inject 0.5 of Volime. So this is the Volime. This is how the needle is. So we always prime our product. So put your head back. I'm going to feel, palpate. We're going to lift the eyebrow up, and we are going to inject slowly. We always aspirate. When we aspirate, we have to wait 5 seconds. And then we're going to inject slowly. Do you feel any pain?
No.
It's very important to listen to your patient. You always ask them, do you feel any pain? Because sometimes if you are injecting, and even if you aspirate and you're injecting inside a vessel, the patient is going to feel a strong and excruciating pain. So we're injecting slowly. Voila. How was the first injection? Did you feel any pain? Okay, very good. And we massage. Voila. If you sit up, so I don't know if you can see. So here you can see we have volume loss, and you feel the lateral side of the eyebrow is drooping. If we look at this side, the temple is fuller, and the eyebrow is more lifted. Go backwards. So now we're gonna work on the middle face. So we want to inject and lift the middle face. So basically, we always plan before injecting. So the most important thing is to mark the lower orbital rim. You have to feel the face, feel the bone, and plan your injection. So usually I like to mark to see what point is the point that's going to give me the maximum lifting effect. So we're going to inject in these areas. And I'm going to use the lift. Yeah. With this needle, please, the red one. So we're going to lift, and then we're going to define the jawline. So you're going to feel a small prick, okay? It's not too painful. So I'm injecting 0.3. And you can directly see the nice lifting effect of the Restylane Lift. It's really impressive how it gives you this nice lifting. Can I have please, a gauze, sterile gauze? And I'm injecting 0.2. Can I have alcohol, please? So looking at this side, you can definitely see a nice lifting of the cheeks. It's not, voila. As compared to this side where you feel the face is droopy and there is no definition. This side is more defined. Now we're gonna work on the jawline. So lift your face up. All right. So the jawline, we see it's not defined, and this is causing a droopiness in this area. You feel the whole skin is droopy. So what we have to do is mark, and we're gonna inject a lifting filler where we have volume loss. So in this way, we can lift the face up without giving too much volume to this area. Can I have another lift? So turn your face to the side so they can see. So I inject on the bone. You aspirate, very important, after priming your needle. And then I'm injecting 0.3 of Restylane Lift. And I'm going to inject 0.2, a bit more lateral. And you also aspirate. So looking at the jawline, it is more defined, and it's giving a better look as compared to this side where you have no definition. So now we're gonna inject the nose. So looking at the nose, we can see we have two dots where we have volume loss in these two areas. So we're gonna fix the nose and make sure that the nose is straight. So I touch the bone, I have to aspirate, and then we inject slowly. We inject 0.1, not more. And then if you look from the side, now it's straight, and then we have a bit of volume loss in this area. I inject, I touch the cartilage, I aspirate. And then a small tiny drop. So looking at the nose, we can see that the nose now is straight. So the last part that we're going to be working on, it's the chin area. We're going to project the chin to give her more elongation, and we're going to work on the lines all around the mouth using the skin booster. Can I have that? So I'm going to inject 0.5 straight on the bone. So I'm going to go with the needle, touch the bone. So looking from the side, you can see that the patient has better projection of the chin. And then smile, please. And we're going to start working on the fine lines. And I'm going to use the Vital, the skin booster, using a cannula, just to minimize the appearance of these lines. So I'm going to use a needle. I'm going to start with the leading port, do an opening. And slowly, using a fanning technique, are you feeling any pain? So I want you to sit up, please. So looking at this side, at the right side, and comparing the right side to the left side. So in the temple area, we used the Restylane volume, and we can see a nice difference when it comes to the volume loss as compared to the left side, a nice lift of the lateral eyebrow. Looking at the cheeks, we have more definition and a more lifting effect of the cheeks. Looking at the jawline, it is more defined, and we have a straight, nicely defined jawline. The nose, is straight nose. We have no irregularities when it comes to the shape of the nose, and the tip of the nose is already lifted. If we look at the chin, it's nicely projected. And compared to the lips, we can see that we have around, like the lips are nicely projected and it looks perfect. So that's pretty much it. Thank you.